Sweet. All right, welcome back, everyone, to week 3 of our VME. Today, if you don't already know, we have Scott and Rob, including myself, as your lecturers for today. I know you guys already know Scott pretty well, but I'll hand it over to Rob just to give like a super brief intro, what you up to nowadays, and then we can get going.
I'm Rob. Cool. Just kidding. So my name is Rob. I'm a physical therapist I'm currently in Orange County, California. Yes, Orange County, California. Aaron, thank you, Aaron, for having me here. I'm a physical therapist. I work, my day gig is I do home health, and then my side gig would be working with dancers and whatnot. So I'm really grateful for Aaron for providing these kinds of like opportunities to continue to stay connected, especially with the hip hop dance community. Primarily, if you've heard of dance prehab is something I started about 3 years ago as a student in PT school. It's kind of grown into its own thing. We primarily serve through dance prehab. If you look at the content, a lot of it is more contemporary ballet, technical dance based. My wife is a ballet teacher, and so we kind of collaborate on things like that for education for mostly like dance studio competitive communities. But ultimately, my background personally with dance started with breaking and hip hop, and so that's kind of where I also want to be able to put my time into. And like I said, thanks Aaron and Offset Med for providing those opportunities for me to stay connected. Just about being able to elevate dancers, but also elevate hip hop in terms of, what's out there in research. I read a lot of your comments. A lot of people have mentioned things like, it's not very specific to hip hop, and what are the things that we can do for that, right? Especially in a research community that's predominantly dominated by ballet and contemporary dance forms, right? So, and that's a conversation we will continue to have throughout today.
Mm-hmm. And just throwing it out there because Rob didn't mention it. If you want to see him perform on ABDC, just look up Instant Noodles Crew.
Hey, there's other ABDC representation in here.
This is true. Let's go. Battle it out. That's for another time. It's for another lecture. We can't get it all out in one. All right. Here we go. Let's get the show on the road, everybody.
Yes.
Here we go. All right, take it away, boys. So yes, today we are going to talk about injury trends in our sport. You've already met us. So Offset Med, our population is mostly interested in our artist athletes that are basically in or performing movements related to hip hop music, art, dance, and culture. So we're really looking to create a culture of artist-athlete hybrids that recognize the importance of health, physical wellness. However, our population is super wide. It's not exactly as, clean and really study as much as the other art forms that Rob mentioned about ballet, modern, contemporary, things like that. So, we think about them as different movement genres, breaking, locking, popping, RIP, urban dance, and other competition teams. And there's new styles and other styles that don't usually get the limelight as much. Crump, turfing, styles like bone breaking that, are missing in the research realm. So we just wanted to talk, since the main, conversation of this topic is injuries, like what exactly is an injury? So here's just a general definition of what an injury is, and it's the transfer of one of the forms of physical energy, whether it's mechanical, chemical, thermal, etc., in amounts or at rates that exceed the threshold of human tolerance, right? If you load something too much or it takes too much energy and it can't sustain it, then there will be a break or a leak. It could also come from a lack of essential energy, such as oxygen, for example, drowning, heat, for example, hypothermia. So we're going to predominantly focus more on kind of the orthopedic side and musculoskeletal side of injuries. Now, in order to get specific with what's happening in the literature, there is an effort to kind of define what a dance-related injury is. And that's any physical complaint sustained by a dancer resulting from performance, rehearsal, or technique class. And at least this is what this current article from Bronner et al. Stated, who is pretty respected in the dance medicine world and literature, and has done research and studies on hip-hop dance forms. But, if you look at the broader things that have been published, there really is no widely accepted definition or universally agreed standardization of this terminology of what do we classify as a dance-related injury. And you can start seeing why as we kind of get through how injuries happen and what leads up to them. All right, I'll pass it on to you, Rob.
All right. So just to piggyback on what Aaron was talking about with dance injuries, and you've, if I recall correctly, in the article that you guys went over, they referred to time loss injuries. So since stylistically and vocabulary-wise, everything is so different, it's kind of hard to categorize like what constitutes an injury. And I think one of the more consistent forms of categorizing injuries within dance, so you can kind of cover all genres, they've been referring to it as time loss injuries. And so it's literally, how many days can you not, how many 24-hour periods can you not dance, or can you not perform secondary to the injury that you incurred, right? So, and that's one that's referred to one of the articles that we'll talk about here. So these 4 articles are not the end-all be-all. These are just some examples that we pulled to kind of give you guys an idea of what people are looking at and how they're looking at it, and probably, like I said earlier, like how they're defining these things, how they're categorizing it in a way that can be that is digestible by the population. However, it is our belief, right, if we know that there are various styles, various art forms within the hip-hop umbrella, how can we be specific to these populations and kind of do these art forms and styles justice by examining them with a much more specific lens? So there's a lot of information on here. Don't take it as like the end all be all. This is kind of like a quick glimpse at what we're seeing. So all these articles, I think, from the earliest, like mid 2000s to most recently, that last one, that 4th one right there. Oh no, the first one that I listed, that one was published June or July of the latest issue of Journal of Dance Medicine and Science. Great. Okay, so next slide. I'm just skipping that one first. So this first one was musculoskeletal injuries in breakdancers. Breakdancers, yes. So in this one, a lot of these research articles kind of come from an epidemiological perspective. So they're taking more like surveys, asking questions. A lot of it has to do more so with like body region. So in this article, this was mostly focused on Korean breakers. And so if you know anything about the breaking community, it's that Korea became a huge powerhouse within the breaking community, the global breaking community in the early mid 2000s. And because it was so popular, the studios and the crews actually received government subsidies to support their dance profession, and also they were involved in events to kind of drum up like not just local support but also global support for Korea. And my understanding is that a lot of this funding for these Korean b-boys and Korean breakers, breaking crews and studios actually came from their tourism bureaus. So the government saw that there was an investment, and it's obviously invested in it. So as far as this specific research study was concerned, they looked at professional and they looked at amateur breakers. And so there's obviously some sort of definition there. Most common injury sites, like upper extremities, wrist, fingers, lower extremities, and the knee, but also going into the shoulder as well. You can kind of also see that they found that professionals obviously had a little more higher rate of injury than did amateurs. And as far as mechanisms of injury, they didn't say specifically what moves they were doing, but then they just reported, this was a sprain, this was a strain, this is tendonitis, probably overuse, right? So a significant amount of these injuries were these three, the 89.6%. Primarily for this research article, they used X-ray and CT scans and MRIs to examine areas of injury, which kind of makes sense with the sprain, strain, tendonitis. These are things that you can identify through imaging. If we go to the next slide, this is just a quick breakdown of where they were finding the different injuries depending on their professional or amateur status, right? So once again, wrist, finger, knee, with the highest rates in the professional groups. Yeah. And next. Good. So this one, breakdance injuries and overuse syndromes in amateurs and professionals. Once again, the breakdown between amateur and professional. This one was probably, represents a much more relevant demographic and location possibly because it was collected at Battle of the Year in Germany, which is a large break-in convention of sorts that's been happening in Germany since the early 90s. So you have professional breaking crews that will come and they perform, and based off of their performance, they're selected to battle for third, fourth, and then first and second place. So here they were able to differentiate between professional and amateur. Once again, if we look at the way they found the information, it's still more epidemiological. It took surveys, 40 professional breakers, which were the participants, right, people involved, and then 104 amateur breakers, which would then be considered the audience. But once again, it's a very kind of basic delineation. It's not really based off of anything other than participation level. One of the things here that is consistent with a lot of studies in dance in general is overuse syndrome. So you can see that there is a significant number of overuse injuries that were reported in this population for this study. And then as far as professionals are concerned, significantly higher overuse syndromes, which is to be expected. Great. And then next slide. Yep. Here's just another breakdown regarding overuse syndromes. So we can see here that the wrist and the hand is pretty frequent in both groups, in the amateur and professional groups. However, professionals were sustaining pretty much almost twice the amount of overuse injuries per person. And once again, this comes back to the definition of what are you defining as an injury or what are you defining as a syndrome. So for this particular study, they looked at the definition of overuse syndrome as carpal tunnel, tenosynovitis, which is inflaming of the tendons. And then they also looked at like impingement syndrome, painless chronic lumps on the back and head, chronic loss of hair, probably from head spins, and irritation of the head due to head spins. Yes. So you're right. They took the effort to like define overuse syndromes for themselves, but then do we see this carry over to other studies? Not so much. In fact, no. Right. Next. Okay, this last one. This one was more recent. This one was in 2019. But once again, more epidemiological in nature. My understanding is that this was collected at the Royal National Orthopaedic Hospital in the UK. And they did categorize their subjects. There were 73 subjects, but they categorized it between hip hop, commercial, breaking, and street. And what are those things? I actually have no idea because it wasn't very clearly defined at all. Once again, they listed their common injury sites in the knee, in the lumbar spine, that's the L/S, and then also in the foot and ankle. What's, I guess, more specific about this study is that they were able to break it down between areas, types of injury. So not just in the knee, but they found that males had more meniscus injuries, whereas females had more patellofemoral pain, right? And then as far as the foot and ankle lumbar spine is concerned, they also found like the ankle impingement was common in both sexes, and then more lumbosacral instability in the females. So once again, the breakdown of it isn't necessarily the most specific, but you can see that there's attempts to do this. This study was actually an extension or based off of the earlier study. I think you guys read the Ojo Fatimi one, where the breakdown was already kind of interesting. If I remember correctly, we had it in here, but we took it out. But initially, I think, they had a section called like new schoolers, and you're like, well, what is new schoolers, right? So yeah, so this is, even though this is recent, we can still see that there are some issues in terms of proper definition. And I'll get into this later, but the issue with proper definition is that if we want to do research that is reproducible, and you have to be able to make sure that you want to make sure that you create definitions that can be consistent throughout different studies. Therefore, you can find patterns that are consistent. Yeah.
Hey, Rob, real quick.
Yeah.
We wanted clarification on what the DP meant on the slide. I'm assuming disc protrusion, or?
Yes, disc protrusion.
Gotcha.
Yes. Sorry, I didn't clarify that. Yes. So once again, categorization is important. Next slide. Here, this is just another quick breakdown of just the areas that they looked at. Now, since this was at a hospital, my understanding is that this data was part of like intake forms and taken by medical assistants. So once again, it's not necessarily within a dance specific context, but it's within a medical facility. Yes. And go to the next one. Sorry, disc prolapse, not disc protrusion. But yeah, so here are just like real quick breakdowns in terms of male and female and the types of injuries that they were able to record. So like I said, meniscal injuries, more prominent in males, patellofemoral pain, more prominent in females as far as knees are concerned. So this is I think this was a good step in terms of being able to break down body region, but at least being a little more specific in that, but it's still not specific to dance styles, which we will look at. Can you, do you mind going back up to that previous slide really quick? Yes, so I know there's a red square right there, but if you look above, they also have like dance level. So it's like amateur, choreographer, professional, retired student, teacher. I think that is another breakdown that you'll, commonly see. They'll break it down by level, but it's still relatively arbitrary, and then it's very subjective, right? And once again, it's not necessarily specific to dance styles either. Okay, and then slide 13. Great. Okay, so this is the most recent one that basically came out last month. And I think I appreciate this one the most because of all the critiques that we've given to a lot of studies that we've read in the past. This one after reading through it, and I'll break down some things, I feel like they were most able to break down movement specific issues within art forms. So they broke it down between hip hop, which I am assuming is more what we understand as like choreography, and then there's popping, locking, house, and breaking. So this was a survey that was given to 146 dancers in Germany, and this was given at dance practices, dance battles, and dance jam sessions. So it didn't seem like these were given at just like schools or arbitrarily to people. These were given to people at events within the community. And I know with Germany is like one of the leading countries in terms of disseminating hip hop back in the 80s. So it's pretty, you got some good roots of hip hop down there. And so as far as this is concerned, they were able to break down specifically what they were seeing with these specific dance forms. Now, as far as an overall look at everything together, they found that overuse, false technique, and no/bad warm-up were kind of the main reasons why people were getting injured. And what I also appreciate too is they looked at when these injuries were occurring or when people were reporting these injuries. So primarily middle activity or end of activity, which kind of correlates back to overuse and fatigue, right? And then as far as most common injury sites, all the previous studies were just like, oh, in the knee, in the back, in the ankle. But this one, they were able to break it down to more style dependent. So let's go to the next slide. Great. Okay. So here we can see on the right, they were even able to kind of categorize specific moves or specific movement qualities that people were having issues with. So you can see that in popping and locking, they were able to specifically describe the knee roll and shoot downs as the most frequent mechanism of injury. My understanding is my background is in breaking, but hopefully this terminology isn't out of date or anything like that. But my understanding of shoot downs was always, if you see people kind of like, they go really quick to the ground and they bring their knees in, but they leave their feet out. So relative internal rotation of your hips and then going straight down to the ground, or in the more rolling motion. That's what you would call shoot downs. If you guys have this presentation, that's a link right there that you can check out. And then for locking, all the injuries that they reported from their participants were knee drops. Right, so instead of rolling down into that internal rotation of your hips with your knees together, it's just boom, straight down. And then in terms of, house, they said a lot of these injuries, or 50% of injuries that were reported, occurred during jumps. Right, so especially with house dance. Once again, I'm not a specific practitioner of house, but a lot more of that upper extremity, a lower extremity, fast footwork, jumps, etc., spins, which may also contribute to the high incidence of lower extremity injuries here, 80% in the thigh. Break-in, what they found here was very consistent with some of the other studies that we referenced, where most of the injuries were in the upper extremity. Great. And here's just a quick art for the breakdown. This is going back to the mechanisms of injury, or why people were saying they were getting injured. So overuse and fatigue, false technique, in this case, our innocent poor technique, and then no/bad warm up. And these are just the suggestions that were given by the researchers in terms of having dance-specific flexibility and endurance training for overuse and fatigue, right? Basically preparing your body to be able to perform at the level that it needs to, or beyond the level that you need to. False technique, so making sure that you're utilizing proper technique combined with protective equipment, or style-specific technique and education. I think was it Matt that had made a comment in the Discord talking about like, you know, people attempting moves that they might not be like physically prepared or ready to do, and how that is a big reason why a lot of injuries may or may not occur. And I agree with that. It's like we see a lot of stuff on, or kids may see a lot of stuff on YouTube or Instagram. And they're like, I want to try that, and then they're not ready to do it. Sufficient warm-up. I mean, that's always going to be a topic to address for us as healthcare practitioners, or even just as practitioners of these art forms. The way a breaker is going to warm up is going to be very different from the way that a locker will probably warm up. Is going to be very different from jumping into other styles like a ballet dancer or a modern dancer, right? All the demands are very different. The things that our body needs to do is different. The way our body needs to respond to movement and perform movement is very different. So warm-up is going to be always a huge issue to tackle. I think with I did like a brief study on low back pain in breakers, and that was also one of the things that we found was like people just don't warm up enough, or they don't warm up properly, right? And to talk more about like the specificity of that, it's like we talk about they were able to break down movements that were specific to like knee injuries, but specific to like popping and specific to locking, and how that may be different. When I looked at b-boys and low back pain, I found that most people were reporting back pain with windmills. And so like windmills and the variations of, so like baby mills, tombstones, etc. So my question that came out from that is, if windmills are considered like a basic move in breaking, and everyone's getting injured by learning basic moves, then are you setting yourself up for further issues down the road because you were already subjecting yourself to injury, or setting yourself for like a chronicity of pain, right? Next slide. So really quick, this is just to kind of give you an overall like look at all these 4 studies that we looked at. Obviously, the first one I listed here in the upper left-hand corner, the injury profile of hip-hop dancers, depends on the art form, which I think is great, and it's nice to actually like see a study that's beginning to break it down that way. Whereas the other 3 studies, right, depending on how they collected data, when they collected data, with who they collected data with, the data is kind of all over the place. So it's not to say that these studies don't have value. I would say that for our purposes, they have value in kind of showing us where research can go, or where research should go, and offering like some insight into occurrences of injuries. But then again, right, it's kind of, you could see the data was kind of like everywhere. So I think this last study that we were able to pull up and add into this presentation today is a good example of, where the proper definitions play a role in research, and how being able to be consistent with definitions across art forms and across styles is going to be beneficial for the research community, because then you can actually refer back to, oh, these 3 articles, or this set of articles looked at this thing, and they clearly defined these things consistently. Therefore, you can find patterns. Because how do we find patterns if it's just arbitrary information coming in and definitions are different, right? It's like, instead of having 3 studies that you can compare and contrast, you just have 3 studies that are completely different. So with that said, I know that was kind of a lot of information. We kind of just threw that out there. But like I said, the emphasis of this being on kind of, when we read research, how are we bringing that information into ourselves, and how are we, trying to find ways to apply, but also how are we trying to find ways to find consistency and improve research.
Cool. Thank you, Rob, for giving us a really big overview of the research in hip hop and all the things that should have been there or we wish that we were there, but now it's starting to take strides towards too. And I think that's really important to note that it's not perfect. Research isn't perfect, and some people take it for like exactly for what it is, and that's not the purpose. Like you have to understand the context and know, I guess, and uniquely in hip hop, which is why we start this VME with understanding the community, the culture, the roots of it, how that plays a big role in what data gets put out and if it's applicable or not. So we're gonna jump into Scott's talk. He's gonna talk about our experience with trying to validate if what was being published matches the current experience of the SoCal or the hip hop dance community here in California. So let's get this presentation up. Do we have any quick questions at this moment? All right.
They're saving it for the end. All right, hi everyone. So my name is Scott. I'm going to give you a brief overview in terms of kind of the statistics that we were able to gather, and I'll give you an insight of how we got those statistics. So just like Rob's previous research studies in terms of how they were able to get the statistics from those athletes or the patients that they worked with, we were able to get our information from individuals that came to us at these events, such as breaking events, as well as like huge choreography events as well. So before the patients come and see us or the athletes, we have them fill out a survey in terms of kind of the location of their injury, and we give them a big drop-down menu in terms of where they felt their injuries were. So it's either the neck, shoulders, wrists, hands, knees, any location that they felt that they had injury. At the end of the day, we were able to put all the information into an Excel sheet, and we were able to extract it and compile it and see see if there's a trend with injuries there. So we'll first off with the breaking community. We were able to we were able to compile stats from 3 different jams. The first one was I Want All the Smoke, Rock the Beach, as well as Freestyle Session. 2 of them had international invites. One was a local jam, and one was a collegiate as well. We can see that and highlighted in yellow, we can see that low back was actually the highest, which is different from what we saw in the previous researches that Rob mentioned, where wrist, finger, knee were kind of the common injuries there. So because of the amount of individuals that we saw, that could have been skewed. However, based off the location as well, I think Rob stated that that was mostly in Germany or so. That might be changing things as well. So I want you to pay attention to the incidence of injuries here for the breakers. We can see that low back once again, neck and some shoulders as well. And then we're going to go on to the hip hop and choreography community. So just like how we got the stats for the hip hop, for the breaking community, we also did it the same way in the hip hop and choreography community. We can see this was compiled more from 4 different locations: H4, Press Play, Arena, and a Good Project. And once again, we can see low back was actually the highest, followed by neck and shoulders. So what does that kind of tell us? We understand that these injuries are here. We understand that low back or shoulders or wrists or neck potentially are the highest causing or highest place locations of injury. So then what now? What do we do? So before we get into understanding what to do, we want to understand more of what do these athletes want. So just like when you do an examination, or if an individual comes to you saying that they need help, you're going to take a subjective exam. The subjective exam is very important because that's going to tell you what most likely will help them the most. because already that patient's already going to know what's going to help them for the most case. So if we go to the next slide, we can actually see actually before that, we did a comparison between two, just like we said earlier. Low back was kind of the highest amount between our breakers and well as hip hop choreography community there. Next slide. So with the survey, we actually asked them as well, what are some traits that you wish you had? And we can see here with the stats between IWATS, freestyle session, and H4, we can see that mobility was actually the highest for all three groups or community or events, and also strength was following that. So we know that subjectively, these are the traits that these individuals wanted. Either they're lacking the flexibility, or they're lacking flexibility, or they're too mobile, and then if they were feeling weak or fatigued. So now that we understand a little bit more of like what they want, we have a little bit of stats in terms of what we've seen that could potentially be causing their injuries. Go to the next slide. Study, you can see here there's two charts. The chart to the left is a study by Russell. We can see that there are common general causes of injuries here, such as improper training, faulty techniques, environmental or biomechanical imbalances, which is basically weakness, or hypomobility, or hypomobility, which is basically they're too flexible or they're not flexible enough. We can also see for faulty techniques, if their positioning of the foot is off, or they're getting too much rotation, or not enough rotation in their hips, as well as environmental hazards.
Go ahead, Scott.
The environmental hazards, the main one is primarily like footwear, as well as the surface that you're dancing on. As I've heard, a lot of the practicing outside on cement, on not well-supported floors, can cause a lot of poor shock absorption and leading to some joint injuries as well.
Can I jump in here really quick?
Yeah.
Yeah. I should also just make a point about this, the graph on the left, excuse me, by Dr. Jeff Russell. This write-up was primarily done through more like ballet contemporary forms. So, I mean, this is an example of like, if you have like a highly structured form, the kinds of information that you can derive and then come up with like these generalized recommendations and general observations, right? And this is something that we have not been able to, at least I haven't seen specifically been able to do with hip hop art forms quite yet. Just because of, like I said, culturally, socially, this is a very highly individualized kind of culture. So, you don't have 30 people in the same room practicing 6 steps the way you would have 30 people in the same room at bar, right? So, just something to think about.
Yeah.
Yeah, and I'll go ahead and just add on to that, in the fact that, that's why in the first couple of research articles Rob pointed out, a lot of them were epidemiological studies, meaning that they're just trying to get a survey of what injuries are present, what are happening, in hopes that if we find things that are more common in this population, we could prescribe an intervention, whether that is strength training, mobility training, creating more safety laws, not exactly laws, but just like people who are able to enforce these other environmental risk factors, things of that nature. So it's just scaffolding. It's an example of what's been done before in the past as we try and pave a new way forward.
So with that information that we just previously talked about, education is another big thing that we want to tell our athletes in terms of, so this chart on the right, you can see on the y-axis the impact load versus the x-axis versus load volume. Basically, if you have a higher impact load with a higher load volume, basically if you're training consistently, going all out every day, you're going to reach that zone of structural failure, which will potentially set you up for injury in the future.
And this is just the tipping point of a lot of this understanding. I think Tim also posted like a model of, going from just general physical prep and getting more specific onwards. It alludes to the earlier injury causes of like, faulty technique, overuse, lack of warm up. Like if these are the common, self-reported injury risk factors, then there is an opportunity to create a dialogue and a bridge to be like, this is what's expected. This is what we're already seeing. This is what the current culture is. How can we change that narrative? How can we address that, right? Mm. So as practitioners, this is kind of the basic framework of understanding that we're working with right now. Is that there are these risk factors involved, intrinsic and extrinsic. Intrinsic are things at the individual level. So, dancer's body mass index, height to weight, strength, their age, sex, laxity, prior injury history. We know that these can predispose a dancer for having an injury. And then you layer on top of that exposure to other risk factors, flooring, shoes, etc. Again, this was predominantly based on more of the ballet, contemporary, modern literature. But when we think about this, okay, what are other extrinsic risk factors that may make a hip hop dancer, at higher risk? And that could be flooring in terms of if they're, predominantly outside, but also not doing the proper or modifying the proper intrinsic risk factors, such as their strength, to cope with the repetitive impact of dancing on a not supported floor. This chart shows that it's very like linear, but I think where we are now is that we have to understand that it's a feedback loop that can be modified. And that's kind of like the benefit with time, that the risk factors for injury and the outcome of when it happens, there is a time period in between. And that's what everyone's working through. Once you get to the end where the inciting event happens, is basically, you can think about it in terms of overuse injury, the straw that breaks the camel back, or in terms of like an acute injury where, it's you're performing and you make a false move and there's something in the way, and then, you hurt your sprain your knee, things like that. So using this basic framework, using the information of what we already know, we have to find a way to put this all together. And, like Rob and Scott said, it's not very cookie cutter. And actually, even the research beginning to say that, injuries itself are very style dependent. So we need to be able to take this information and apply it when the situation seems fit. So we'll go over some individual case studies from Scott and Rob and how they took this information and what the patient or athlete was saying to them, and then actually applied it.
So I'll start off with my example of a stability case. So this actually happened at Rock the Beach. And this individual came in stating having some pain over his side, kind of low back area. He said that happened whenever he was doing any type of floor work. And he mentioned that he's able to reproduce it by like bending over to the side. So I said, show me. So he stood up, he like slided his right hand down the side of his leg, and he was like, oh, it feels okay here, but this only happens when I come back up. And I'm like, interesting. So where is it when you come back up? And he mentions it's on the other side of his trunk. So for those that kind of have some history in terms of what potentially could be going on, my first thought was, okay, if you're having pain going on to the side, it could either be if you go diagnosis based, there's the facet dysfunction over there on the right side. Basically, it's not closing enough, Or if he's having pain on the left side when going down, there might be a flexibility issue or mobility component to that muscle called the quadratus lumborum. But he actually had discomfort when coming back up. So that's just telling me it's something a little bit more contractile based. So after assessing and determining that it might be due to weakness, I wanted to confirm that if it was weakness, and I asked him, hey, like, what are some exercises that you're doing to kind of prepare you for these movements that you're doing on the floor? And he mentioned nothing. So I did a quick assessment, just made him do some side planks, try to see how long he could actually hold the side plank for. We could see that on his left side, he was only able to hold it for about like 10 seconds, while on his right side, he was able to hold it a little bit more, around like 30 or so. So a quick treatment, I just had him do side planks with hip dips. Basically, he's on his side and he's dropping his hip up and down, all on his elbow and feet. After about 3 sets of 10 or so, had him stand back up and then reassess. Basically, had him slide his right hand down the right side of his leg and coming back up. He mentioned less pain and felt actually more stable, or felt better that way. So that's an example of where we need to understand if there's a difference between mobility, basically flexibility, or if they need a little bit more strengthening and stability with that.
Thank you, Scott. So for I will. This one, I think it should be context specific stability. But for the mobility case, the specific individual I was working with was a breaker, and he was having specific issues in his shoulder when he was performing 1990s. 1990s are a move which, if you're literally in a handstand and you're on one arm and then you're spinning either way, either regular or dead man's. So his specific issue was that he had shoulder issues before that had sort of resolved, but he was still unable to he was still having like discomfort in sort of his acromioclavicular area, which is where your acromion in your shoulder blade attaches to your clavicle right up front here. And so he had to maintain this like upright motion or upright position, but it's not just being able to lift your arm overhead, it's being able to lift your arm overhead while you're upside down while also bearing weight. So the demands of that is going to be very different versus just being able to do this, right? For him specifically, with any kind of shoulder mobility, obviously you'll look at your shoulder complex, but one of the things I also like to look at in terms of overhead mobility, whether it's your hand up in the air or your hand on the ground, is going to be rib mobility, just because of the proximity of your shoulder blade to your ribs and the ability for your rib to expand, and that thus allowing for a little bit of side bend, thus allowing for basically improved fluidity of motion within the shoulder complex. So for this specific individual, he was presenting with shoulder discomfort, but what I found with him was that the side in which that he likes to bear weight on actually had less mobility through his let's say in my case right now, his left side of the ribs, preventing him from being able to kind of extend throughout his entire trunk and torso. So once we were able to kind of give him some exercises to emphasize rib cage mobility, thoracic mobility, all of that was able to contribute to the fact that he was having to bear weight on his arm overhead upside down. And so by improving mobility in I guess his ribs, we were able to also inherently improve a little bit of mobility in his shoulder too, which then allowed for less stress to be in his shoulder and allowed it to be distributed throughout the lateral side of his upper torso. The other thing for him was that his full-time job when he wasn't breaking he's a full-time programmer. So you can imagine what that does, especially with like prolonged periods of computer work, etc. So for him, it wasn't just about, it was about his dancing, yes, but for him, it was just also about general health throughout the day for himself to stay moving and whatnot, and trying to figure out what a good regimen for him was for his work specifically, right? He wasn't feeling any discomfort throughout his work, but it was when he was doing the when he was breaking, when he was practicing, is when his kind of like his problems arose. But then it you can see how like it's not necessarily just with dance alone. It also contributes in terms of or other factors of our life also can contribute to movement in general. I just saw a question here. Did I use inferior glide on a costovertebral joint? I think I talked a little with this. Thank you, Kazuto, for your question. I think for this individual specifically, he had good strength, right? So I wasn't going in necessarily for, I wasn't really digging into any muscles, and it was just like, and this person was coming from a distance away, so I wasn't going to say like, hey, come to me twice a week so I can like massage things out so you feel better. For me, it was more about giving him the tools to be able to do it on his own. And although the single impact of like a session that he would do on himself may not have been as great, but for him, it was more about consistency and being able to stay with that mobility, eventually allowing for carryover of the intervention. Right. So I didn't specifically use inferior glides. I actually just taught him like very general rib mobility over a foam roller and stretches that he could incorporate not just prior to dance or during dance, but even just for his work as well. Right. Cool. And then as far as context specific, instead of mobility, it should have said stability. I forget why I didn't correct that. But for context specific stability, at one point, there's an individual who was dealing with, he basically wanted to have more control of his like lower extremities while performing like freezes. And we basically talked about, hey, these are some ways that you can think about abdominal stability and control, but not just in like planks or not just doing like sit-ups or anything like that. But if you're on your shoulder, how can you figure out? We basically figured out specific ways for him to think about stability, but in an inverted position, right? So that was specific to this person.
Cool.
Sorry, I know we're running out of time. Yeah.
So it is coming near the hour mark. So I don't expect everyone to continue to stay with us. But we know that it is recorded, so we'll continue to press on for those that have the additional time to stay with us to finish up. But any last minute questions before we get on? All right. So let's just hit these heavy points. So really, it's plan, call to action. What can we do as healthcare providers? So go for it, Scott.
So just like kind of pulling in from the research that we saw in terms of kind of the common injuries occurred after mid-session or towards the end of their session, basically caused by fatigue. Then we also saw that poor warm-up was also another factor there. And then pulling back to Rob's example of context-specific stability, those are all very common things that we need to take into account. So it's good to address an individual that comes into us with specific injuries or pains and give them kind of like a general idea of like warm-ups or stretches, but we might potentially be wasting their time if we're not able to figure out, okay, what is it specifically that they're having trouble with. So if we talk about the difference between a general population individual coming in or a dancer that we see, a general population patient might have low back pain, and we determine that it's due to, let's say, like a stability issue where they're lacking some strengthening. Typically for an individual that has some strengthening issues, you would give them these like typical general exercises of dead bugs, bird dogs, side planks with rotation, stuff like that. However, if we go into an individual such as like a breaker, we might want to go a little bit deeper in terms of like holds that they are unable to do. So basically say if they're having trouble with the windmill, you break down the windmill movement and you stop them at a specific portion of that windmill where they feel that they're having trouble performing. And specific education, just like what Rob has talked about with context-specific stability, you want to be able to find out which specific styles that they're doing and they're having most trouble with. So follow up on all of that stuff that I just said. Us as healthcare providers, we need to basically individualize our treatments to dance specific. And based off of like our conversations that we've seen on Discord, some individuals actually might be lacking the common base support of movements, such as push pull and all that stuff there. So we basically need to just do a proper assessment of what they're lacking and then focus on the ones that they have deficits in.
Cool. Thanks, Scott. And, I don't want to limit this just to healthcare providers as well, like dance instructors, fitness professionals, just movement professionals in general. Like, we know that the injury research has shown that there are deficits, that there is a common site of injury in terms of like low back pain, knee pain, and that dancers want strength, dancers want mobility, and these are easy ways, and these are the tools of your craft, how you can just intervene. Why wait and screen for all these dancers to like present themselves with these susceptible predisposing injuries already, when you can already apply the intervention? You already know that their sport is going to require this amount of strength, this amount of mobility, so prepare them for that. Usually as healthcare providers, we kind of see them on the other end when it's like almost too late. So if we want to take a preventative, proactive approach to it, then this is how we need to shift the perspective. So, a lot of you here, we are movement professionals at the end of the day, but that doesn't mean that we all know exactly what is available and when to use and how to use and at what specificity. There's a lot of different things that are prescribed for just injury quote unquote prevention, but also injury rehabilitation, management, things like that. And I just wanted to pose this question and have you guys reflect about this on the group, maybe put in the comments. Is the pictures displayed here, like strength training, kettlebell training, Pilates, whole body cryotherapy, manual therapy techniques, and really regress body weight exercise, band resistance exercises. I think a lot of practitioners get siloed or get super narrowed in to one or two, maybe three, right? And the goal is to help people experience and understand the options that are available. But if you're the expert, if you're the professional, you need to also prescribe what you really recommend is going to help them, but also work with what they understand it to be. And, that's a whole nother conversation. But just understand that it is a toolbox, but you've got to be a skilled practitioner. You got to learn which tool to use and how to use it. So at the end of the day, it really is all about perspective. My feelings and the feelings of the colleagues around me, injury prevention traditionally has always been very biomedically constructed, as you can see in the research on how it's very broken up into body part based. And injury is just perceived to be the physical event resulting, just like that definition, in a sudden release of environmental energy producing tissue damage in an individual. Very microscopic. So this is a reductionist perspective, overlooks the importance of psychological and sociological determinants of injury. We are much more than just cars. You can't just go to the mechanic, fix a part, we're good, right? So this article actually kind of is a bridge to kind of see how we can think about it. And maybe instead of injury prevention, we're really about safety promotion. Um, Safety is much concerned with the subjective dimension or the perception of safety, whether it's real or not, as it is with the objective dimension, or otherwise known as the absence of injury. I think injury prevention professionals that really get into it, and injury prediction, they're really, really focused on like, how can we just like not get injured, the absence of injury. Well, you're only looking at it from one lens, right? So it is much concerned with the community in which the individuals reside as it is with the behavior of the individuals who comprise the community. So now we're not just talking about the dancer anymore. We're talking about who's a dancer learning from, what's their community like, what are their influences, perceptions, what are these behavioral nudges that are telling them to act a certain way, behave a certain way. So safety has physical, psychological, and sociological dimensions. So I wanted to present this graph by Hansen. He kind of started talking about the shift between just reductionism of injury prevention, and shifted it more towards like an ecological approach towards human and safety promotion. So as you can see at the top, we have the individual. You can think about that as like the intrinsic risk factors of an injury that a person may have. This is what you're able to see. This is what they're able to understand and feel. So at the intrapersonal level, you have their behavior, the stuff that makes up their biology, but then you have the stuff that makes up their psychology. So the perception of like strength training for them could be threatening, or maybe it's not. Their understanding of injuries, do they, self-catastrophize, or are they resilient when injuries happen? And the different coloring between the white and the gray is kind of marked at this waterline, meaning that these are the things that, we traditionally can like see and intervene with, but then that can only do so much, right? If you show up at an event as a performer and maybe they said they don't have enough time for your tech, they're not paying you for the event, they're playing fog and smoke in the ends, you can't breathe very well, and you have no union. It's like these are other determinants that affect your overall health and affect your injury risk as well. So we start getting a little bit deeper. Level 2, your interpersonal. Where's the home, family, peer group support like? Then we can dive a little bit deeper into the organizational level. So this is kind of their association with work. This is kind of like health organizations in terms of if they're doing any type of work towards that community. Clubs, associations, you can think about that as like teams and crews, and their demand at school if they're going to school. Are they a student athlete at school as well? And then we can kind of, again, go deeper into the community level. And this is stuff that affects everybody, not just dancers, but because of the community understanding and societal level of understanding of what dancers are and the structures and the systems built around it, you can see how they all have trickle down effects into the individual level. So really, if you take a look at the broader perspective, what we do is effective, but you don't have to just be a physical therapist that treats the body part. You don't have to be an athletic trainer that just is there at the event for injury management. I think everyone's role, if you're instructor, personal trainer, teacher, like everyone can play a role in this. So again, kind of just like plan, call to action for everybody is there's just a lot of work to be done, especially in the research community and academia, but also in education for everybody. I think we saw in the VME group chat that a lot of things in hip hop it's not really like documented. A lot of things are missed out. Even Arnell said that in his lecture as well. Things are passed down word of mouth. History is passed down. Techniques are passed down. But this is all happening within that world versus what's happening kind of in like the sports science, human performance world. And you as people can be the gap, can introduce those ideas, because as we know it, dancers are receptive to it. They want to learn how to get mobility safely. They want to prolong their career and stay healthy. They want to get stronger. So you need to create your toolbox and get really good at using it, and also communicate that and bridge that gap. So that's it on my end. Do we have any just general thoughts, questions, discussions for any of our speakers today? Rob, Scott, thank you again for presenting all that information. It was a lot. Good job, everybody.
Thank you, Aaron.
Thank you,
Scott.
I kind of have a general question, I guess more personally. So looking at it from a research side, have you guys actually, or maybe even thought about like even reaching out to colleges that look into biomechanics a little bit more? Or, I mean, there are, professors and doctors that do look into dance biomechanics, and reaching out to those guys, and even just having that introduction, and also figuring out research questions to kind of, play back and forth a little bit.
Yeah, I appreciate that question a lot. And I think the creation and purpose of how we got together as Offset Med, we realized that there was a higher need to be active in the community first before we got more specific in the research realm of specifically biomechanics. I do think that there's a place for it, and given our resources and energy, while we aren't able to kind of reach out and take the horns on a project like that, we would definitely support that idea. Yeah, I just know that doing biomechanical analysis and studies is very time consuming, and you probably need a dedicated biostats person, biomechanical statistician. And then you have to ask about, what kind of studies are we looking at? IMU data, EMG, just 3D kinetic analysis, things like that. So I think yes, to anyone that wants to pursue a graduate degree and wants to study and are extremely interested in that, please do it. And you'll have a community of support to back you. I think the hardest part is really reaching out to this community, letting them know that, look, like, these people are here to help you. Research can be cool. And if you do research, it'll benefit you in the long run. Because I think, like Rob has pointed out before in the older articles, there's such a big disconnect. They don't even speak the same language. And so if you try and roll up and, print this nice PDF of a dancer doing something like cool, and they're like, enroll in my research study, it's not going to reach, and that's where we go beyond just, like the medical bioeducation. You start talking about marketing, human psychology, like how do you really get into contact with that person?
I agree. Aaron.
Yes.
Yeah, I think so. So just from a personal point of view, I think with at least with like institutions and whatnot, a lot of these professors and researchers are there because they have grants to do research, and they have grants because it's deemed important to the general population, right? And unfortunately, it's like with hip hop, it's like it's not the general population. And so where do you find the support in that? So when I was a student, I was very lucky to have a professor who was also a dancer herself, but also had established herself as a relatively prominent researcher. And so I was kind of able to, and her specialty was low back pain. So I was able to kind of slip in and be like, oh, hey, maybe we should look at low back pain in breakers, you know? And so, and that was like a culmination of a lot of like different things. So instead of just like swooping in, it's like I had that relationship with that professor. She knew that I was invested in this community, and she knew that I was invested in doing some kind of research as a student. So it's like Aaron said, there are like so many factors to consider. And then again, like any kind of EMG study or any kind of study where you're taking like literally, you know, this is like thousands and thousands of data points, and having people to put that all together is hard, you know. I think one other thing I would also like to mention is that, you know, when we talk about research and we talk about this community, it's like a lot of, at least from my perspective, like coming out of school, like a big conversation is always like, oh, PTs aren't getting paid enough, and like we're not getting paid our worth, et cetera, and like insurance is always doing this and blah blah blah. And so it comes down to that whole thing about, well, am I doing this because I want to do it, or am I doing this because, you know, what are my reasons for doing this, right? And it's like, I've come to that conclusion where it's like, if I do work within this community, it's like I can't just roll up and be like, well, these are my rates, and unless you can pay my rates, I can't treat you. You know, that's just not part of what I would do, you know. And it's I guess my broader thing is that a lot of things require money and resources, and unfortunately in the systems that we operate within, it's like unless you can prove that it's worth the money and resources, like that just doesn't happen. So in this community, and especially with a community like you guys, you know, you're here in your own time, you're wanting to do these things in your own time, like that is so valuable. And I think, you know, that is what makes this so special. And like with Offset Med bringing everybody together, because we're all here because we want to do these things regardless of what it is for us. Like we're really here to give. We're not really here to kind of like give, oh, but what am I getting? You know what I mean? Yeah. Sorry, that was a bit of a rant, but
I know Cos put, what's the weirdest thing that worked for your dancer patient clients? Tiger balm, ultrasound, eating certain foods. I say the weirdest thing is TJ. Just put TJ next to somebody.
TJ is just insane. TJ will just wave his hand in front of you and we just say like what's bothering you? Like, talk to me. Just talk to me. And they leave like after like 15 minutes. Like, oh, I feel so good. I'm like, what the heck you do?
Oh no, McGill, the Stairmaster.
Avocados. I once had someone claim that avocados was like messing with your balance, and I was like, I don't know about that. Maybe, I don't know, but we never got to the review. Nick's, your question, clarify how weight bearing might cause mobility issues in inverted movements. Okay, great. So right off the bat, if we think about muscles having to operate, right? Let's say, for example, the most specific example I can give is if you're in a plank position, if you're just sitting with your arms outreached and you like reach forward, you're performing protraction, right? Scapular protraction. So you're just reaching forward. So that is going to be your serratus muscle, like generally speaking. This is going to be your serratus muscle pulling your shoulder blade forward on your ribs, right? If I have my arms in a push-up position and now I'm having to lift do like a push-up plus for the serratus muscle. Now this is going to be, it's almost reversed. Instead of my muscles having to protract my arm and my shoulder blade, I'm using those same muscles to now lift my ribs and my torso and my axial skeleton. So the demand is inherently different. It changes. And so then when we're talking specifically about mobility issues, right? If I am in this position overhead and I can very easily just lift this, but it's just like I have to do this against my arm, right? So I'm just lifting that. But if I'm upside down, then all of a sudden expanding this is also having to expand with the weight of everything else above it, which would be like my hips and my legs and things like that. So being able to look at what's going to be important, especially in like hip hop dance population, and when you come to like individual styles, is looking at how people are doing things. It's like being able to see how their positions may affect how either muscles work or how their positions might affect how well they can move, right? I hope that makes sense. Yeah.
Izzy, I saw you had like floating eyes and open mouths earlier, so I didn't know if you were confused or just having a mind-blowing moment.
No, that was just one of the most mind-blowing things I've ever heard, and all of a sudden, like, all sorts of training I do made sense.
Awesome.
It's like my whole life just made sense.
Thank you, guys. See you later, Tim. Thanks, Francis. Cool. I know this was a lot longer than usual, so I appreciate you guys sticking through. I know Rob is going to be open and available for comments as well via Discord. You can just kind of tag him if things kind of come up during the week. Miguel is also a pretty big practitioner of house dance, so if you wanted to get more in depth on like what that stress or load may look like, you can always tag him. Ferrari. Let's see. Have any of you guys had a client who was a bone breaker? Really curious about if bone breakers feel crazy pain or discomfort when training their style. Miguel had one. Do you want to hop on?
Okay. No, they didn't really have any pain. I think that style attracts a certain type of person, right? And they have a certain level of mobility already in the shoulder joints, and that's something that you can train. But that training specifically for that stuff like arms behind the back, I think that comes with a genetic predisposition to having ranges of motion in that. But you can't train that. But no, it's not like they experience pain while they're doing those motions.
Thanks, Miguel.
Yeah.
And I would like to clarify that, I think when you get into a healthcare profession, there's almost like this unspoken demarcation between general population and athlete population. But at the end of the day, we are all general population, and some people are just athletes more than others.
Yes.
If you're LeBron James, yeah, you're basically a full-time athlete, right? So when they're talking about like sport-specific training, athlete development, all that stuff is like great, but like where does it fit in the individual's current lifestyle and where they want to go, right? So I mean, it's very different for artists as well, because the majority of them have to work another job or do other things to support their artistic ventures. So, for someone like bone breaking, it's not like they're bone breaking 24/7. I'm pretty sure that would hurt a lot doing it often. But then you see someone who's like at Cirque du Soleil and they're like one of the contortionists. You can't find those people. They pay those people a premium because, like Miguel said, they've happened to have genetics for it. They're trained for it, and they meet like they fit the identity of that. So I think it's very variable. I think the more you understand just people and see like their passions, that you'll kind of get a general understanding of what they need. Sometimes it's low hanging fruit. Sometimes it's the very like niche specific things.
Like, do you choose the dance, or does the dance choose you?
And that's it, everybody.
Yeah. But yeah, I mean, it's true. It's like, to some degree. And so since I work primarily with a lot of like ballet and contemporary dancers, and a lot of these kids are like, oh, I want to be more flexible. I want to be more flexible. But sometimes I'm like, if I move your hip to a certain degree and I feel that bony end, I'm like, that's going to be it. You know what I mean? And then the conversation becomes about like, well, how do you move with them? How do you educate them on the facility that they have?
Yeah.
Right. So, and I'm sure in a lot of the same way with breaking or any kind of like hip hop form too. Right. They'll come to a certain extent where there are just body limitations, and they want to and everybody wants to push their limitations for sure. But where does that educational component come in to be like, if you keep going down this route, you're doing more damage than good. Yeah.
Well, you think about it in terms of, I'm just going to use a sport that everybody, or the activity everybody knows, right? Powerlifting or like really heavy weightlifting. You see the people that are really good at that have a certain body type, right? Yes, of course they train to have that body type, but even at like prior to training, weightlifting is like a shorter person sport. Compare that to taller person sport. Not to say that somebody tall could be a good weightlifter. They're just going to have to really, really push those boundaries much. I'm like, and somebody that is under like 5'10" is going to have a really hard time being pro basketball player. It doesn't mean they're not going to be good. It's just those limitations. Same thing with dance, right? You'll end up finding something you enjoy, and then you'll find something that you're good at because your body likes the way that feels on it, right? And then you kind of go down that route.
Cool.
But then a little less drastic. Both those are very just like polarizing things.
Harari, if you could take your question and repost it in the VME, I will have to end the call at 11:30. So, yeah, thank you again, everybody, for just like your time and sticking it through and listen to us all. Thank you, Rob and Scott. Give it up for them. Woo.
No, thank you, everybody. Thank you, Aaron. Thank you, Offset Med.
Thank you for everyone listening.
All right. So I'll be posting next week's module. So continue the questions. I love that momentum. And we'll see you guys next week. Okay.